all of you on stage tonight with different specialties but working in unity.
Do you know that there is two consent?
We've heard of many treatments out there, but how do we know which ones are effective and which ones are not?
So it's not about what is effective, it is about what works for you and what your personal goals are.
Thank you, doctors. It's a pleasure to have you here on stage with us. And congratulations to all of you on the launch of this beautiful clinic. I took a tour and it's absolutely lovely.
I'm Dr. Shazadi Kohli. I'm the medical director of Tajmeel, Dubai, and specialist plastic surgeon.
السلام عليكم، حياكم الله في عيادة تجميل كلينيك. شرفتونا ونورتونا. معاكم الدكتورة أميرة العضب، استشارية جراحة التجميل.
Hi, good evening. I'm Dr. Yalda, the restorative and aesthetic dentist. I'm so amazed with the crowd. Honestly, I'm so happy with the show up, and we can't wait to have you guys with us.
Hi, my name is Dr. Anna. I'm a specialist dermatologist. Thank you for coming.
What is the one thing that people are obsessed about, in your opinion?
So what I've seen in the recent past is in my practice is that everything is moving towards quiet luxury, and that also means quiet rejuvenation. So nowadays, when we get patients in the clinic, um, they basically want a treatment which shows that they've slept for about 10 hours, hydrated themselves, and probably been on a 2-week vacation. And that's what we have to achieve for them. But keeping that in mind, it's all very natural and not overdone.
Thank you. Thank you for that.
Previously, a couple of years ago, we were so affected with the social media and the fake results. Thank God this is all changed. So now, as Dr. Shehzad said, it's more about natural looks.
I mean, for me, there's two sides. There's one that they're just obsessed with super white teeth, like 20 veneers, super white, which I do not recommend, of course. And then we are now having, the other side where there's so many patients who want a natural smile, which is amazing because we're moving towards natural. So even in dentistry, veneers are becoming more natural. Some people go for other options, not necessarily veneers, aligners, just simple treatments. So it's really natural is what we're aiming for.
Doctor.
So I heard a lot from my patients now about salmon DNA. Everyone wants salmon DNA injections. And the good thing is that it's not only popular thing, but it's really effective for tightening, healthy looking skin. So I think it's a very good treatment. And thank you that it's popular now.
And how many sessions do we need to start seeing progress?
So
here?
usually for all skin boosters, it starts from 3 or 4 sessions, but we all are individuals. So sometimes we can see very good results starting from the first one or the second session. So I think it's better just to check the skin and then decide to, the amount of the sessions.
Okay. So we've heard of many treatments out there, but how do we know which ones are effective and which ones are not?
So it's not about what is effective, it is about what works for you and what your personal goals are. And it's not just about one particular area. We're looking at the patient as a whole. And I think that's what's important. So I think this synergy, what we have here, mashallah, it's great. And we're so proud to have this together. Yeah.
That's fantastic to see.
What we built up, as we said, is the team. So we have a team that provide this. Most important, the safety and the results. So we aim to satisfy the patient in a natural, with the good expectations, and also we don't overdo, and especially. We take the patients not only for one practical treatments. Sometimes they will come for me for breast surgeries, but I will see that they need liposuction with it. So I will team up with Dr. Shehzadi. And if patient comes, I say, like, what can I do in my face? I said, you don't need to do anything. You need to be fix your teeth, and that's enough.
Yeah.
So it is a harmony of 360 and treatment for a patient.
I like that honesty and, just telling the client or the patient, you don't need this. It's how you build trust.
As doctors Shazadi and Amira said, we really work together. We don't treat only one part of the body. So
And apparently, 80% of us grind our teeth at night and we don't even know it.
definitely.
Botox is a solution to this.
It just relaxes. It's all about the muscles, musculature, really.
Right. Thank you.
So it's really nice that all our doctors were happy to make our patients healthy, not to overtreat, to make extra volume or to do very white teeth, right? Veneers. We try to keep our patients healthy.
Right. Thank you. And it's nice to see all of you on stage tonight with different specialties, but working in unity. And I want to take this opportunity to ask about that connection, the connection between skin, between body, between scalp, and between smile. So, can you tell us about how we treat them all separately, of course, but how are they connected?
It's all connected by beauty. So, there are some factors that affecting that, especially the skin, the guts, your body.
Yeah.
So
Inflammation.
one of cause that can destroy these connections is the stress.
Yeah.
So nowadays we are in a bit stressed situation. So we have a lot of people who comes to Dr. Yelda because of the, as you said,
The grinding
the
of-
teeth grinding and all. And she will refer us to Dr. Anna regarding the skin looks. And Dr. Anna will refer us to, because most of the patient due to stress, their cortisol is high. So the fat distribution will be stubborn in some areas.
Yeah.
So this is all connected in one time.
Basically, diet.
Yes.
I think it starts from diet.
And there's a root cause
That's
for
where
everything.
it's
And I'm sure when you see problems with the skin, you're going to peel the peels of the onion to get to the root cause, right?
Absolutely. So I think like when we start with skin treatments, the first thing I ask about is their diet and how is their sleep. I think that's a big, huge factor. Of
Yeah.
course, like environmental factors as well, and then smoking and all of that. So everything basically increases stress and the cortisol and all of that. So what we have here at Tajmeel is everything that brings down these inflammatory responses. And so we have, for example, as Dr. Amira mentioned, we have the hyperbaric chamber, which delivers oxygen. We have the red light therapy. Also to reduce the inflammation. We have the ozone therapy. So we have everything which is available to reduce inflammation at a cellular level for longevity and recovery.
Yes, doctor.
I mean, diet is 100% of how we work together. Let's start from the basics. Patient comes, patient has a cavity, patient has been eating a lot of sweets. That sweets, patient will get acne, Dr. Anna. And then patient will get fat, our doctor. So it's really all connected, That's how the mouth, skin, body is connected. It's all
Also
about
the hair,
diet.
of course.
Hair, 100%.
Yeah, so even with stress or if you have certain deficiencies,
Yeah.
the hair's affected. So we have different treatments for that, which is with mesotherapy or exosome stem cells. So all of that is available as well. So
And as doctors, as we are really doctors, so we try to treat the reason, not the symptom, but the reason of
Yes.
this skin condition or hair condition or I don't know, fat. So, and I think it's very important for our patients to understand that they're in safe and they're in good hands.
So, since we are talking about safety, let's talk about this the protocols, the safety protocols. How have they developed over the years?
Do you know, whoever going through a surgery or a procedure, that there is two consent as a new regulation? So there is informed consent and there is procedure consent. So informed consent, it's most important than procedure consent. Procedure consent is just a legal documentation for the clinic and the doctors allowing to perform a procedure or injectables to you. But when it comes to the informed consent, it's the explanation, the complication, the pre-op, intra-op, and post-op care. And it's very important to have the time for us in Tajmeel. The minimum amount, the minimum duration of a consultation is 45 minutes for each patient, because we need the patient to understand and knows what is going through.
Yes.
There's a lot of novel novel treatments like peptides and exosomes and eventually stem cells that we're still dabbling with and that are probably not haven't reached that level of approvals, right? Because it's still very new. What is your opinion on, say, peptides?
So I think in good doctor's hands, it's a very good treatment. But if sometimes patients they go to the pharmacy, they can buy this pen and inject itself. No, my opinion, we can do it, but under the strong control with blood tests. We need to see each other each week or 2 weeks to understand how the patient feels. It's very important because it's your body, it's your health.
I think it's a very upcoming sort of this thing. We are seeing very good results with it, but like Dr. Anna said, it's very important who your provider is and how efficiently and thoroughly they have looked into your blood works and then recommended a certain treatment. So this should not be, everything should be on label and not off. So I think that's what's important here.
Okay. I'm going to open it up to the audience now. Do we have any questions for our doctors?
Hi, guys. Thank you so much for that lovely discussion. So, I have a question. We have a lot of aesthetic clinics here already. So, what would you say sets Tajmeel Clinic apart from the rest?
Safety first.
And why do you think that your clinic is more safe than the others?
Because we give the full time for the patients. I guarantee you, like, if any patients comes to our clinic and then we say we are the first place that we come and they give us more than 45 minutes as a consultation. Plus, we give the patients time to ask, to go back, read, and come back to us. We do 3 consultation before any procedure.
So, like Dr. Amira just said, it's about being honest with the patients as well. So, I think we're not saying that the other ones are wrong, but what we do over here is we say no a lot, and not because we like to, but because they don't sometimes need the treatment. So I think that's what probably, and also because we have each other. We also have another set of eyes always, and we consult each other and we take each other's opinions because I may have overlooked something that the other person will not, and I think that's what is different over here.
So, what was interesting was that you guys have a biohacking side, along with your aesthetic clinic. How do you integrate that into your protocols?
So that part support us a lot, especially with the outcome, with the fast recovery, with the effective of the procedure.
How do you define beauty and aesthetics?
Beauty comes from in before outside. So if you are happy with yourself from inside, you will reflect this outside.
It is just about, like I said previously, quiet luxury.
Let's say in a dentistry kind of perspective, someone comes to me and shows me a celebrity, and I want my teeth to look like this celebrity. Hence, they have this idea that if their teeth looks like that celebrity, then that maybe they might be as beautiful as this celebrity or as confident. But beauty really, like, each individual is beautiful in their own way. And even if I do your teeth exactly like that actress or actor, you're always going to be beautiful the way you are and not like anyone else. And that's why I always try to encourage my patients, go for something that suits your lips, go for something that suits your skin tone, that suits the whites of your eyes. Because if the whites of your eyes are not that bright,
I
then
didn't
you
know
do
that.
super white
When
teeth.
when I came to you, it's just like your teeth should be similar to you,
As the white of your eyes. Exactly. So imagine if your teeth are too white, people will just stare at your teeth and they will miss all your other beautiful features. So it's all about, just helping that person feel more confident in their own way.
Please give them a huge round of applause.
Thank you.
Our
Thank you
doctors
so much.
from Tajmeel.
Thank you.
Thank you so much. So fantastic to have you here tonight.